Okay. Now today we will be talking about the infectious disease. Last lecture we had already discussed about the blood cancer, and we all have seen that this particular cancer, or you can say the transformed cell, if the blood cell, which is having a most important role, they play as the warrior of the immune system. If they will only get transformed, only they will get the you can say mal shaped, or you can say the mal structure will be there. So there is a lot of disturbance, and ultimately majority of the case is the death only. But same way, there are many infecting agent which are hiding themselves inside the blood cells. So when this infectious antigen, they are harboring inside this blood or blood cells, so that particular time they disrupt the bodily metabolism. And this applied hematology uh, means the knowledge of the blood, or you can say the blood studies. We are applying this particular knowledge to study this infectious disease. So we will be talking about the few infectious disease here. First we will be talking about the malaria, then we'll discuss about the leishmania, then thereafter we will be talking about the disturbance to the shape of any blood molecule. Like first we will be talking about the most important cell, that is the hemoglobin, that we will be discuss after the infectious disease. So first we will be talking about the malaria. Now we all know that the malaria, it is a mosquito borne infection. Which mosquito is involved? We all know that is the female Anopheles mosquito. They are sucking and the blood of the human, and in turn, at the time of the sucking, if she is harboring the this, not necessary every time, if any mosquito will bite you, or if any, even the female Anopheles mosquito is biting you, will be giving you this infection. If she is having this uh, protozoa in her salivary gut, that time only she can infect you. So this particular disease is affecting human as well as other animals. Now we all know the main positive agent of this disease is the protozoans of the plasmodium species. Now what are the signs and symptoms? So symptoms that typically include the fever, fatigue, vomiting, and headache. I repeat, the common symptom, it is the fever, fatigue, vomiting, and headache. Now this is into the initial stage, but at the time of the severe cases, it can lead to the seizures, coma, or it may also cause the death. Symptoms, if we will see, it generally manifested after 7 to 15th days. Now, why such a long time? Now, in SYBSC, we all have learned in detail about this parasite, that they incubate in our body and they take a long time for means becoming infectious. So for that particular reason, their symptoms to occur, at least it takes 7 to 15 days if not properly treated. So it may cause means recurrence of this particular disease can may occur after the few months also. Classic symptoms of malaria: sudden chills with the shivering, and it followed by the fever. Then after the fever you will have sweating. Means lots of sweat will come occurring after every alternate day. Means one day fever will be there, one day you will feel हाँ मैं ठीक हो गया, but it will not be the case. Alternate days पे fever will come, and the disease is transmitted by the female Anopheles mosquito. This mosquito bite introduce the parasite from the mosquito saliva into the blood. Now these parasites are carried to the liver. Now how they are going to the liver? By the blood, where they mature and reproduce. Five species of Plasmodium are known to infect the human. Most deaths, these are caused by the Plasmodium falciparum and Plasmodium knowlesi, Plasmodium vivax, Plasmodium ovale and plasmodium malariae. So these are the general cause of the milder form of the malaria. Now what is the diagnostic technique? Now as I told you that they are coming from the blood, so usually these are confirmed by the microscopic examination of the blood films. Now see, in the last lecture I had already explained you the how these blood films are been made, that the blood of the patient is taken on the clean slide, and thereafter they are spreading it with the slide or maybe the spreader, and thereafter they are making the slide. And we have already learned that the two type of slides are there. So when we are making the slide for study of the parasite, that time we are making the thick slide, or maybe antigen based rapid diagnosis tests can also be done. Even advancement into the medical technology, especially diagnostic technology, has done a lot. So now we can do this particular diagnosis by the antigen based rapid diagnostic test. Malarial antigen detection tests are the group of commercially available rapid diagnostic tests, so that are allow quick diagnosis of the malaria by the people those who are not otherwise skilled into the traditional laboratory techniques. So these RDTs for detection of the malaria antigen, all these are based on the immunochromatographic test principle. Immunochromatographic test we have discussed when we were talking about the applied immunology, and we know these tests are based on the agglutination. So these RDTs, they capture the parasite antigen from the peripheral blood. Now how we are capturing, as I told you, this is the serological assay. So here we need to make the monoclonal antibodies. So these monoclonal antibodies, these are prepared against the malaria antigen, and after that they are conjugate to the particles into the mobile phase. So this particular test contains the immobilized monoclonal antibody, and these antibodies, they will be capturing the antigen. Now once the antigens have been captured, what will happen? Antigen antibody complex will form, and this will give a visible line. So if malarial antigen is present into the blood sample, antigen antibody complex will be there, and they will form a special line. So all this, when this antigen antibody complex will be formed, it will combine with the labeled pen specific antibody which is present into the mobile phase. See, this antigen and antibody complex, this will migrate to the test strips, and that will be captured by the specific antibody present into the immobile phase. So simply we can detect it. A major drawback of use this dipstick method is just result is the qualitative. That means you can say whether the malarial parasite is present or not present. They cannot test the number of the malarial parasite, but they can detect the presence. As say example, this UTP, urine pregnancy test. So what it says, it can confirm the pregnancy, whether the lady is pregnant or not, but it cannot say for how many months she is pregnant. So same way it is also like that only, that it is just a qualitative test. After performing this particular test, you can confirm whether the patient is having the malaria or not, but you cannot say that how much the patient is affected. Now for this particular thing, we have to supported by the microscopic detection method that use the for doing all this. So we can do the polymerase chain reaction to detect the parasites DNA have been developed, but not widely used, not necessarily that every time for detecting, because see, detection is most important whether the patient is having the malarial parasite or not. So if it is there, so immediately treatment is being started. So most drugs used in this treatment that are active against the parasite in the blood, it includes the chloroquine, then quinine, then quinidine, doxycycline, all this use into the combination with the quinine, etc. Now here, treatment, why we are learning, so that we should have the basic idea, but again I'm telling you the most important unit point, exam point of view is the diagnosis, because here we are applying the knowledge of the hematology for the diagnosis purpose. Now second is the leishmaniasis. When we talk about leishmaniasis disease, it is caused by the parasite of more than 20 different species, that is known as the leishmania. Now we know leishmaniasis. It is a type of disease which is also called as the Kala Azar. We have learned in detail about this particular disease in SY basis. Student, just a minute. I will be back after 5 minutes.